Good afternoon, everyone. Welcome to another Facebook Live Lunch and Learn with the Center for African American Health. So I want to take this opportunity to thank you for sharing our Lunch and Learn broadcasts with others in the community. And I encourage you to sign up for our weekly e-blasts, which include flyers and updates on our programs. Please visit our website, caahealth.org, and sign up to be included in our email distribution list. We're very busy at the center. This coming Tuesday, September 22nd, we're conducting a drive-through flu clinic in our parking lot located at 3350 Hudson Street. Community members can show on a first-come, first-served basis. They'll be provided to adults only. If you have insurance, it'll be billed. Otherwise, we're providing vaccines free of charge. And in fact, today, we're just wrapping up a flu clinic. So today we're wrapping up our COVID-19 testing clinic. So as we'll touch base on our discussion later today, just doing everything we can to remove barriers between community and the things that can keep us healthy. So as we wait for a few more people, I'll go ahead and introduce myself. My name is Deidre Johnson, and I'm the CEO and Executive Director for the Center for African American Health. For those of you who may be unfamiliar with our work, we have been in the community for more than 20 years with a focus on commitment, a focus and commitment to improving the health and well-being of the African American community. As we move through today's session, please feel free to type your questions in the comment area and we'll address them if time permits. You know, we have all read headlines in the news and various publications reporting the fact that communities of color have been disproportionately affected by COVID-19. The data reveals a correlation between this outcome and health disparities related to economic, social, and environmental disadvantages. Today, we're going to discuss some of the reasons this public health issue has impacted communities of color at a higher rate and what is being done to change this outcome. I'm very excited that our guest today is Jim Garcia, who is the CEO and founder of Clinica Tepeyac, a community health center with a mission to provide culturally responsive healthcare and preventive health services for the medically underserved. The clinic has been in the community for 25 years and provides services in English and Spanish. The two of us have worked together, actually in different capacities throughout the years, to address some of the historical inequities that negatively affect people of color. And today we want to focus on what our respective organizations are doing to meet the needs of our communities. Welcome, Jim. Thank you for joining me.
It's great to be here. Thanks for the invitation.
You know, I actually remember, I don't want to date myself, I remember when Clinica first opened back in the day. And so it's been so wonderful to see your organization's growth through the years. While I'm personally familiar with your background and the history of Clinica, but could you spend some time just to share with our viewers more information about your path, as well as how Clinica's services have grown over time?
Sure. So yeah, it was probably 27, 28 years ago. I was a new member to Our Lady Guadalupe Church in Northwest Denver. And like I think within the African American community, at the time, Our Lady Guadalupe was a hub of social justice activity. And I remember my first parish council meeting, the pastor came in and said, you know, we have a huge challenge in our community. We have people coming by the church office almost every day asking for help, either directly or indirectly related to their health care or mental health care. And as a church of limited means, we really had nothing to offer them. So he said, you know, we have this little rundown house that we own across the street. Wouldn't it be great if we could convert that into a clinic to serve the community? And at the time, not knowing what was involved, I thought, well, that sounds like a great endeavor. And so I took it upon myself to get the process started, doing a community needs assessment and really just interacting with the community to really legitimize what we knew was a real need in the community. And we, through just a grassroots effort, the community came together and renovated this little house, converted it into a 2-exam room clinic. It was initially run by all volunteers from the community. And we opened, last year we celebrated 25 years. So we've been growing stronger each year. So it's really been a labor of love, but I think it's a testament to the will and the faith of a community where they saw a need that was there, and the community rose to the occasion and created this really incredible organization that's serving the community. We're now located in the Globeville community. We took over what was once a Denver Health and Hospitals clinic in the Globeville neighborhood, and that was about 15 years ago, and we've been operating in the Globeville, Elyria, Swansea neighborhood ever since. Although the patients that come to Clinica Tepeyac come from all of the Denver metro counties, and so we see patients from all over, and so it's people come to us who have very, very few options for their medical care, people who are uninsured, and in many cases undocumented and are not eligible for public health services. So we meet a very critical need in the community.
And aren't you didn't you recently become a FQHC?
We did about 5 years ago. Clinica Tepeyac received its federally qualified health center designation, so that was an exciting step for us, and it allowed us to really further develop our integrated model of care, which is providing medical, dental, and behavioral health services to the community. And at Clinica Tepeyac, we take it even a step further than other federally qualified health centers, in that we also have a health promotions team we refer to as promotoras, who are out in the community. Although it's now with COVID, their activity has been limited, but they're still very active in terms of social media and interacting with the community in that way. But we have that connection with the community through our promotoras as well.
And I just think it's such a wonderful story about how first years ago a need was identified, and now look what's grown and flourished to solve that need. Can you say a little bit more about the primary and preventive care that you offer to individuals in the community?
Sure. I mean, we offer the whole spectrum of primary care, pretty much from birth until, and we provide services to our senior citizens as well. And so, and the whole spectrum in between. We also we have a very robust prenatal program at Clinica Tepeyac. We also have a thriving HIV program that we started about 12 years ago with in partnership with Denver Public Health. And so, along with providing the whole spectrum of primary care services, dental services, behavioral health services, we were able to meet the needs of the entire family that needs our services.
So during, since COVID began, have you noticed any changes in the population that you've been serving?
Not so much in the population. I would say more so in, when COVID hit back in March, we had to immediately shift to telehealth services. So that was a big shift, and that happened within a 10-day period. We had to stand up our telehealth services so that we could offer services virtually for the first few months, and we are continuing to offer those services today. It was just that first month in March was extremely challenging for us. We had several of our clinical staff tested positive for COVID, and as a result, we had the majority of our clinical team had to quarantine. So we actually had to close for a week just to get our staffing in order and just to kind of get our feet on the ground, so to speak, because it was it hit so quickly, and we had to really be able to respond to this overwhelming need in the community, like all the other health centers and hospitals were doing. And so we were part of that front line that was directly impacted. Since then, we were able to, after that first week, we're able to reopen, and we've been going strong ever since. We're now getting back to seeing the majority of our patients in person, although we still are seeing patients through telehealth, and that is going well for the most part. But I would say that our patient population prefers the in-person interaction with our providers, So we're trying to do as much of that as we can.
Wonderful. So related to that, we know that among communities of color, there's a long-standing mistrust for the healthcare system due to a historical legacy of mistreatment and discrimination. How do providers at Clinica Tepeyac work to overcome that barrier?
You know, I think I would go back to when we first opened our doors in the little house on Calumet Street. I think the reason why we were created, I think, is because so many members of our community were not having a great experience interacting with the larger health system, and you know, the feedback we were getting was that, you know, they just didn't feel welcome. They felt like they were just a number, and we felt it was so important, especially with our Latinx population, that in the immigrant community, that we wanted to create a welcoming space, a safe space for our community. And so I think that's the niche that Clinica Tepeyac fills, and our providers and our staff that is the driving philosophy, is that we want people that walk in our doors to be treated with the utmost of respect and compassion, and to feel like they're an honored guest in our home as opposed to a number. And so I think that is the driving philosophy that we impart with our staff. Most of our staff are bilingual and bicultural. I would say all of our clinical staff are bilingual and bicultural. And so, you know, that is really who we are. And I think that's what Clinica Tepeyac has been come to know. People have come to know us by just our that level of cultural responsiveness to the community and meeting the community where they're at.
So this week kicks off the start of Hispanic Heritage Month, which takes place through October 15th. Please share the purpose behind this period of recognition and what it means to the community.
Yeah, I think for us, it's the Latinx Awareness Month. That's how I have come to understand it. And I think it's just really a recognition of the contribution that the Latino community as a whole has brought to the community. And I think just an opportunity to recognize the rich history and culture of the Latino community. And I think for us, it's as a health organization, I think also, you know, as an organization that is part of that rich history, as a Latino-led organization, you know, we want to be part of that celebration of other Latino organizations that have been founded by the community, for the community, and that they are serving the community in a very important way. And so I think this month is just an opportunity to highlight that, although it's something that we're proud of throughout the year. So I think it's just a great opportunity to recognize the contribution of the Latino community.
And, you know, and given that social gatherings are at the top of the list of things that are complicated by COVID, when we talk about this Heritage Month, it's hard to imagine really celebrating the way you want to without doing it in person. What are some of the conversations you and staff are having within the community to kind of help curb the spread of the virus?
Yeah, I mean, I think like the African American community, our Latinx community is a very social community. Our intergenerational families are a big part of who we are and part of our celebrations. And so I think it's just it's been obviously a challenge, you know, when it comes to the social distancing. I think it's what we try to do at Clinica Tepeyac is be that source of good information, good medical information, and making sure that our community understands the critical importance of social distancing and wearing masks. And I think that it's just something that we need to do in a very culturally sensitive way, you know, to through all of our communication and our communication with the Spanish language media, especially to make sure that message is getting across, because I think sometimes with social media that there's so much misinformation out there that the community is really looking for a reliable source of information and how to best respond to the current COVID crisis. And so we feel like we're part of that solution and part of that source of good information for the community.
So we'll take some questions if we have any. But first I'll share a few resources. You can visit Clinica Tepeyac's website at clinicatepeyac.org, clinicatepeyac.org. You'll note on the home page that the clinic is offering free COVID testing on Tuesdays and Thursdays by appointment only. So please check for additional details. You know, one of the things that's been very clear, and I'm on a couple of different task forces around the whole COVID piece, and I'm constantly on different calls either with you or your staff as well. Early on when the numbers started rising and suddenly we saw our death toll kind of happening, what was astonishing but ultimately not surprising is I felt like folks were suddenly blaming us, like, oh, it's because they're doing this, this, and that, which is one of the reasons we started doing this Lunch and Learn and other things, not only trying to keep community safe, but really tell the story of what's driving this whole dynamic that we have.
You know, it's interesting, Deidre, we were both Center for African American Health and Clinica Tepeyac were featured in a recent Colorado Public Radio story. And I think it was, they did a good job of explaining. And I think what we tried to communicate was just the fact that our communities are on the front line of this COVID crisis. You know, even before COVID, our patients were the ones that were, you know, they were working 2 and 3 jobs in those frontline positions, and they would come to us just so they could get well, so they can go back to work to support their families. And so with COVID though, that presented another level of challenge in that now there's this heightened concern around being a frontline worker, that now you have to be mindful of your extended family and not infecting family members. You know, we've had our members of our clinical staff whose entire families have been infected with COVID, and it's just a very real issue for us as a Latino serving health organization to know that our employees are on the front line and their families are impacted as well. And I think it's just really important for people to understand that our communities are those frontline workers that we hear about every day, and they're putting their lives at risk each and every day.
Right. And, you know, not only at risk serving folks who are providing healthcare, but at risk in grocery stores, you name it. We tend to not be able to have that luxury of working from home unless we're very fortunate.
And I think for us, there's that additional fear factor. I said, even before COVID, there was the issue of the public charge, where many of our patients were fearful of going outside of their homes to just to go about their daily lives or coming for a medical appointment, because there's that fear that they were somehow going to be engaged by ICE, and that and they know that could very well entail a very bad outcome. And so there's that additional level of fear and anxiety that our community is experiencing because of that issue as it relates to their documentation status. So that's something that we're, again, trying to always present our organization as that safe space where people know that they can come and they're going to be safe, their information is going to be safe, and they don't have to deal with that ongoing fear when they're coming to get their medical or dental or behavioral health appointment.
Right. So one of the questions we have, how can Black and Latinx communities be true allies to each other when battling the various elements of systemic racism that impact our mental and physical health?
You know, it's interesting. A few months ago, our daughter is a junior in college, and she's we were having dinner one night, and we were talking. I think the protests were just getting into full gear, and she asked me, well, what is Clinica Tepeyac doing about systemic racism? And I said, well, and I went on to talk about everything that we're doing around health equity and just some of the good work that we're doing. And she listened, and then she said, well, that's great, Dad, but what have you spoken people like Elijah McClain by name, and have you taken it that step further? And at the time, I said, you're right. I haven't taken that extra step, and that's something that we as an organization need to do. We need to do more than just protect the status quo. We need to reach out to our sister organizations like the Center for African American Health and make sure that we're doing everything we can to, from an advocacy point of view, to make sure that that the broader community understands the historic issues around systemic racism, especially as it relates to healthcare. I was just learning more about a story that's just evolving now out of started in Georgia about within an ICE detention facility. They're performing hysterectomies on ICE detainees, women who are detained at these ICE facilities, obviously without consent. And so I read that there's an African American nurse by the name of Dawn Wooten, who is the whistleblower in this case, who brought this story to light. So I think there's that, in this case, that very clear intersectionality of people recognizing systemic racism and taking that step to address it, in this case, in a very public way, in the form of being a whistleblower.
Right, and realizing how this echoes the history of what's been done to people of color throughout history. I also personally think that it's easy to get siloed in the work that we do in community, but I think systems rely on that. They assume and they fuel divisions when they occur. So I love it when we just naturally come together, as we actually tend to do much more than people think. And so I appreciate you visiting us here today, because I've always appreciated your role in community. Even when I was at the trust and we worked together from kind of a foundation grantee perspective, and just as a wonderful thought partner. But when I think of someone who I see, whether it's a census meeting or just another meeting about how can we remove barriers between what a community needs and the resources that are available, you and Clinica are always at the forefront.
Well, I think we both recognize, that so much of what impacts our community happens outside of the exam room. When we talk about the social determinants of health and just everything related to where access to affordable housing, access to fresh food, access to a safe space for our children to play, that all of those issues combine to impact our communities. And I think our communities in particular, our Latino and African American communities, those are issues that are on the forefront of our thinking and the thinking of all of our community members. And so I think it's just, for me, it's just a very natural step to have that connection with the Center for African American Health, because I have recognized for such a long time just the important work that you all do, and just I feel like we're that much stronger when we're working together towards a shared objective.
Definitely. So we have another question. Do you have any words of encouragement for Black, Indigenous, and people of color during this time of COVID-19 and just the increasing exposure to systemic racism?
It's interesting. A few months ago, I went down to the Aurora Police Department. There was a protest that had been organized around Elijah McClain, his murder, and I. What was energizing for me was that the whole protest was organized by students, high school students primarily, that organized the event and just organized the speakers who were all young people. And it was just, even though there was a lot of emotion and a lot of anger at this event, but it was all, I think, coordinated in a way that you saw that there's this next generation of leadership that was emerging at times like this, when they recognize that, you know, that this is an issue that is affecting their generation, and that they are positioned to step into that leadership that's going to need to happen to address this issue going forward. And so for me, that was a sign of hope, I think, to see that leadership emerging from the community. And in this case, they were all African American young people who had organized this event. So it was that was very inspiring for me and gave me hope.
It is inspiring. It'll be interesting, because one of the things I try to do in talking to my sons and other young people is really let us know what you need and let us know how we can support you, because ultimately, you know, it's their turn to lead and take the charge. And it's not that we've had our turn, but we just need new, fresh ways to attack the same age-old problem. Because the fact that, you know, I can remember the clinic opening, and even back then I was doing a lot in the early childhood realm, and that we're still having the exact same discussions about the exact same disparities. I think it's exciting that this new generation really wants to let's just change these systems versus let's continue to tinker around and see what small changes we can make.
No, I think you're absolutely right. I think that there's a seismic shift that's happening right now with this generation of leaders that you know, they're not going to tolerate for the tinkering around the edges anymore. That's just not acceptable from their perspective, and it's not acceptable from our perspective either. But I think, like you said, having that fresh perspective and that energy infused into these issues that we've been dealing with for so long. But I think from what I've been observing, that there is that shift that is starting to occur, where the spotlight is now squarely focused on this issue of systemic racism. And I think that the current generation is not going to allow it to fall back under the surface. They're going to keep it front and center, so that this is an issue that we're going to continue to work on and find solutions.
Yeah, I appreciate that. It's interesting because it's almost like the silver lining of the tragic experience that has been COVID-19 has been the ability to make sure that folks don't look away, that this has to be dealt with and has to be improved.
Yeah, that's it. I think that you know, I'm an optimist by nature, I think, and I think even with the current political environment and how discouraging that can be, I think with the level of youth engagement that we're seeing, I think there's going to be a shift in the political environment too, because there's this current generation is not going to tolerate the status quo, and so I think there's a lot of reason for hope.
Well, thank you so much for joining us today. I'm sure our paths will cross soon, especially with discussions about vaccines and trials and just getting in front of this COVID challenge.
Yeah, from my perspective, it's not a matter of if, but when we're going to be working together. So I think it's just, again, I see it as just a very natural relationship, and I just truly appreciate the level of friendship and just ability to know that I can call you and you can call me anytime, and we can work together on behalf of our respective communities. So thank you, Deidre, for this invitation.
Thank you so much. Well, thank you again. We're out of time. This video will be available along with other information on the center's website at caahealth.org. Thank you so much for tuning in today. Next week, we're going to have a lunch and learn discussion with the founder of an organization called Amplify Impact. And he'll be discussing the community's power to impact positive change. So we're excited to have that discussion. Take care and be well.